Molecular, antigen, rapid, PCR, RNA. You've probably heard many of these terms used to describe tests for an active COVID-19 infection. But what are these tests? How do they work? And how accurate are they? There are two main types of diagnostic tests that look for the presence of SARS-CoV-2, the virus that causes COVID-19: molecular and antigen. For the patient, both tests seem similar. Mucus or saliva is collected through the nose or mouth. Sometime later, you get a result, positive or negative. The differences are in what they're looking for, how sensitive they are, the speed and cost of the test. A molecular test detects the unique RNA of the virus. The most common type is a PCR test, short for polymerase chain reaction, the lab technique used to identify genetic material. A PCR test is considered the most sensitive, meaning that under ideal conditions, it correctly identifies almost all people who are infected. Most molecular tests require the sample to be processed at a lab, and the turnaround time for these tests can be up to a week. The second test, called an antigen test, detects the presence of a particular protein on the surface of the virus. If you've seen a picture of SARS-CoV-2, these are the spikes poking out of the surface of the sphere. The antigen test mimics natural antibodies that bind with these spikes. If the virus is present, it binds to test strips and provides a visual readout. This test is cheaper than the molecular test and faster. Results are provided where the test is administered in under an hour. However, there's a trade-off. Because the test is less sensitive than molecular tests, it's more likely to yield a false negative result, missing the presence of the virus in individuals who don't have enough of it to show up on the test. It's important to keep in mind that no test is 100% accurate. They may miss infections if swabbing isn't performed properly, or if a person is early or late in the course of illness, when virus levels in the nose or mouth may be very low. They can also produce occasional false positive results, telling individuals who are not infected that they have the virus. They may also be less accurate in areas where the prevalence of disease is low and when used to screen asymptomatic people. But both tests can be used as part of a larger testing strategy, weighing their relative strengths to best sort who is safe to return to work, who needs treatment, and who needs further testing. Some experts think that extensive testing, with results delivered quickly enough, could help to control the pandemic.